can hear from our members. We are highly effective. We have field organizers and members in states across the country. Together, we are securing vital health protections for families everywhere through persistent action, including thousands of messages to Congress and regulatory agencies, hundreds of public hearings, press conferences, congressional office visits, community engagement, media outreach, and more. We tell Washington, listen to your mothers, and they are listening. More importantly, they are acting. We have made amazing progress in our fight, but we have more to do. Our work is never done. Protections aren't strong enough until every family is safe. Mom's Clean Air Force mobilizes parents and caregivers using the most precious and renewable resource of all, love. Moms will do everything to keep children safe, and we are uniting to take action that ensures a better future for everyone. Join us. Meet some of the more than 1.5 million members of Mom's Clean Air Force who are united in taking action to protect clean air and children's health. Founded in 2011, we are the largest and most influential climate and clean air movement led by moms, dads, and caregivers. In 2017, we launched our Latino community outreach program, Ecomadres. We connect science and data with real people. We make clear why everyone should care about climate disruption, air pollution, toxic chemicals, including petrochemicals, how they harm our bodies and our minds, why they are so dangerous. We demand action and justice in every breath. We open doors at every level of government and agencies such as the Environmental Protection Agency so they can hear from our members. We are highly effective. We have field organizers and members in states across the country. Together, we are securing vital health protections for families everywhere through persistent action, including thousands of messages to Congress and regulatory agencies, hundreds of public hearings, press conferences, congressional offices, community engagement, media. We tell Washington, listen to your mothers, and they are listening. More importantly, they are acting.
Te tengo aquí conmigo, algún día partiré. mano, aún dependo de tu actuar. El futuro de este mundo aún lo puedes rescatar. Lucha por mí, lucharé por ti, y vota por los niños. Algún día recordaré lo que por mí lograste hacer. Lucha por mí, lucharé por ti, y vota por los niños. Algún día recordaré lo que por mí lograste hacer.
I'm still young and need your hand while I grow and take a stand. Will you help protect our planet? Will you help protect this land? I still have you at my side, but one day we'll say goodbye. I'll inherit what you left me. May your legacy bring life. Please fight for me. I will fight for you. And vote for all who fall. And for all the children. One day I hope to speak of you, your view, and your wisdom for tomorrow. May it bring you help. Lucha por mí, lucharé por ti, y vota por los niños. Algún día recordaré lo que por mí lograste hacer. Tu legado me acompañará para poder seguir. Te tengo aquí conmigo, algún día partirás, me quedaré con tu herencia, ¿qué legado dejarás? Aún camino de tu mano, aún dependo de tu actuar. El futuro de este mundo aún lo puedes rescatar. Lucha por mí, lucharé por ti, y vota por los niños. Algún día recordaré lo que por mí lograste hacer. Lucha por mí, lucharé por ti, y vota por los niños. Algún día recordaré lo que por mí lograste. still young and need your hand while I grow and take a stand. Will you help protect our planet? Will you help protect this land? I still have you at my side.
Meet some of the more than 1.5 million members of Moms Clean Air Force who are united in taking action to protect clean air and children's health. Founded in 2011, we are the largest and most influential climate and clean air movement led by moms, dads, and caregivers. In 2017, we launched our Latino community outreach program, Ecomadres.
You thought a mother's biggest concern was her delivery, but her health and her babies is shaped long before birth. Black women and other women of color live in places where the air is more polluted. Tiny soot pollution particles enter our lungs, our bloodstreams, and can even cross the placental barrier. This can increase the risk of high blood pressure, preterm birth, and pregnancy loss. Harmful smog and hazardous chemicals in the air can make pregnancy even more dangerous. Babies are born too soon, too small, at greater risk for lifelong health problems. Infant deaths are higher in communities of color, leaving families with unimaginable grief. And it's not just the air. Plastics contaminate our water, food, and bodies. Harmful contaminants from plastics and everyday products can alter pregnancy hormones, raising the risk of early birth, low birth weight, and developmental issues. Black, Latina, and Indigenous mothers are exposed to even more of these harmful chemicals. Tell lawmakers that cleaning the air and getting rid of toxic chemicals are key to protecting mothers and babies. Tell EPA to honor their mission to protect human health and the environment. Protect mothers and babies. No more delays. Because every mother deserves a safe pregnancy, moms and babies deserve a healthy start.
Good morning, and thank you for joining us for the Maternal and Children's Health in a Dangerous Climate, the impact of air pollution, plastics, and extreme heat on women of color, presented by Moms Clean Air Force. Now, please welcome to the stage Moms National Manager for Health Justice, Almeda Cooper.
Welcome. Welcome today to our in-person and online forum, Maternal and Children's Health in a Dangerous Climate, the impact of air pollution, plastics, and extreme heat on women of color. Moms is hosting this forum because of our unfaltering commitment to progress despite the chaos, cruelty, and reversal of environmental advancements in protecting clean air, clean water, and a healthy environment to live in. During the forum, we will be talking about environmental factors that impact maternal and child health on women of color. We've designed the flow of the forum to have an arc that begins with laying the foundation with Dr. Sharon Malone, and based on her many years of practice as an OBGYN, as well as her very vast personal and professional experience. Dr. Malone, author of the New York Times bestseller, Grown Woman Talk, has written and spoken extensively about the unique health challenges that women of color face, including the chronic burden of systemic racism. We look forward to her sharing what she hopes more people and this audience know about issues facing women of color and their health. Jessica Cutes, from the 19th will complement Dr. Malone's expertise in women's health with her knowledge and environmental, toxic chemics, and heat factors. The arc flows from this foundation focused on the current state of women's health to our expert panel, who will delve into the environmental multiplier threats that aren't discussed enough relative to maternal and child health and women of color: air pollution, toxic chemicals, and heat. This fantastic panel combines their personal experience and professional knowledge in a conversation we are calling How Dirty Air, Toxic Chemicals and Plastic, and Extreme Heat Are Hurting Pregnant Women of Color. I know you will enjoy Ms. Priya Vatheja, Ms. Nsedu Obat Witherspoon, Ms. Luz Drada, and Dr. Doris Brown. The impact panel is followed by two segments that will help us identify what we can do about this state of affairs from a policy perspective. Barbara Rodriguez, a 19th reporter, will chat with Dr. Julie Gonzalez about improving maternal health outcomes for women of color. About confronting maternal health inequity in communities of color. After which, Dr. Jalon White Newsom will provide her policy perspective about improving maternal health outcomes for women of color through policy. The last formal presentation will be given by Reverend Dr. Leslie Copeland-Toon, who is going to bring an uplifting voice to this very heavy conversation. She's going to talk about looking ahead, care, community, and commitment. Stephanie Reese of Moms Clean Air Force will close us out. Now for a few quick housekeeping matters. Our program will be continuous until the close at 11:30 a.m. So please replenish your refreshments or access the restrooms, which are located directly outside of this room, as you need to. If we have time, we will take questions from the audience, both in person and online. If you need to leave the room, because we are live streaming today, I just ask you to be mindful of the cameras and try to avoid them as you're exiting the room. One special guest is unable to be with us today, and she asked me to share a personal message with you. Representative Lauren Underwood is leading an appropriations hearing at the Capitol this morning and is unfortunately unable to be with us. Here's what Representative Underwood would like us to know. Good morning, everyone. I am so sorry that a scheduling conflict has prevented me from joining you in person for today's forum on maternal and children's health in a dangerous climate, hosted by Moms Clean Air Force. But I would like to recognize and thank the leadership and staff of Moms Clean Air Force for organizing this important event and for their longstanding advocacy on behalf of children and families. Their work is critical to protecting children from the devastating health effects of air pollution and climate change. As the co-founder and co-chair of the Black Maternal Health Caucus, I have worked to address these critical issues and advance the comprehensive solution to our nation's maternal health crisis, the Momnibus Act. This sweeping package addresses every driver of maternal mortality, morbidity, and disparities in the United States, including climate change. Within the Momnibus, the Protecting Moms and Babies Against Climate Change Act would make robust investments in initiatives to reduce levels of exposure to extreme heat, air pollution, and other environmental threats to pregnant people, new moms, and their infants. To save moms' lives, we must pass the Momnibus. Thank you to Moms Clean Air Force for their partnership on this critical work and to every person in this audience for their commitment to this cause. I can't wait to see you again in person, but until then, please take good care. Thank you we thank Congresswoman Underwood for those wonderful remarks and her passion for saving moms' lives. I challenge everyone within the sound of my voice as you participate today to keep in mind what my hero, Shirley Chisholm, said. You don't make progress by standing on the sidelines, whimpering and complaining. You make progress by implementing ideas. Now I ask you to welcome to the stage Dr. Sharon Malone and Ms. Jessica Cutes.
We had a small printing snafu, so I'm going to be reading from my phone as well. Thank you for the introduction, Almeda, and thank you all for being here today. I'm Jessica Coots, a climate and gender reporter at the 19th. And as a journalist, I spend a lot of time reporting at the intersection of gender, environment, and health. And I can tell you that the data and the personal stories behind that data are both urgent and clear. Women and queer people of color are facing some of the most severe health disparities in this country. That's why I'm excited to be joined today by Dr. Sharon Malone, a New York Times bestselling author, OBGYN, and longtime advocate for women's health. Her new book, Grown Women Talk, is an unflinching look at the realities women face and the power of knowledge to change them. Thank you so much for joining us here today.
Thank you for having me.
Great, thanks. So I wanted to open up our conversation by talking a bit about Mobile, Alabama, which is where Dr. Sharon Malone is from, and it's where she starts the book. It stood out to me because I'm currently working on a story based in a place called Pritchard, Alabama, which is just a few miles away from Mobile. And I'm writing about a community there that is on the brink of a public health emergency. Their water and sewage infrastructure is failing. They have faced water contamination for many years. And I'm profiling a woman who has seen her community's health decline. She's advocating for resources to fix this issue. And I'm bringing it up because I think in some ways it is foundational to the conversation we'll have today, and these health disparities that impact communities of color all over this country due to pollution and climate change. But I also know that that's only part of the story. The other part, which your book opens with, is the health disparities that are sort of baked into our healthcare system and that you witnessed growing up in Mobile. And so I was wondering if you could talk a little bit about how you saw that play out in your own community and how that impacted the women in your family and their health.
Yes, thank you. Being from Mobile, Alabama, that gives you a rather unique window into disparities writ large. And my mother and father were from rural Alabama, which is, believe it or not, the infrastructure is far worse than even in Mobile and Pritchard. And when they came to the city, you realize that how we interacted with the medical community was practically non-existent because they had never had a positive relationship with a doctor. And when you're in rural Alabama, there are no doctors to have a relationship with. But when they moved to Mobile, one of the things that I realized, looking back, I said, you know what? We never went to the doctor. We never went to the doctor because that wasn't how we engaged. You engaged when it was too late, when the situation was dire. But I had to take a minute and look at the street that we lived on. And I lived on St. Anthony Street. And it was clear, it's funny, when you live there, you don't think about it. But I look back on it now, I said, wait a minute, we were in very close to downtown Mobile, but there was just one little residential block. And I lived next door to two hospitals. One was the old Marine Hospital and the other was the city hospital. I mean, a stone's throw from my house. The hospital that was very close to us was a TB hospital. Now, you have to ask yourself, why would a TB hospital be situated in the middle of a residential community? And, well, we know why. Because when it comes to any sort of environmental issues, Black people lived in areas where they lived next to waste, the city dump. They lived next to chemical plants. We had a lot of that in Mobile. So the very worst quality of air, of water, of life even, because we had paper mills and we lived in an area where it stunk. It wasn't as if, oh, I wonder what's in the air. You could feel it, you could smell it. This is the history of Alabama, but it is the history of Black people, poor people, every place in this country. The absolute worst places to be environmentally is where we are. And there's a little bit of history here because, my mother, unfortunately, lost her life to colon cancer when I was only 12 years old. And there is no doubt in my mind that where she lived, how she grew up, the types of things that she was exposed to were very different and influenced the quality of her health and the length of her life.
And how did those disparities also play out in terms of the health care that she received? Or I think I remember in the book, that she maybe didn't go to the doctor early enough or didn't have the information.
Yeah, it's a combination of things. She didn't know, she didn't know what the signs were of colon cancer or when to engage. And what happens is sort of a self-fulfilling prophecy.
Mm-hmm.
If you have a doctor to engage with, and I think this is one of the fallacies, that we think that Black people don't engage with doctors because we're thinking about the Tuskegee experiment, or we're thinking about Henrietta Lacks. We're thinking about all these other high-minded things. And I can assure you, we did not know about the Tuskegee experiment then, nor did we know about Henrietta Lacks. You engage or don't based upon the quality of the interaction that you have with the people that you are engaging with. Mm-hmm. And if you are in a position where you feel unseen, unheard, disrespected, and that same is true today, mm-hmm. This is true now as it was 50 years ago, then that is not encouraging you to really engage with that community. And I have to tell you that the health care that was available to Black people in Mobile, Alabama at that time was substandard. Mm. So it is a combination of things, but don't think that people are not engaging because of some other reason. No, it is all about the one-on-one and how do you feel. If every time you have to go to the doctor, and this was Jim Crow South, you've got to go into the colored entrance of a doctor's office. You have to pay cash because, that's the only thing that they have. You don't have insurance. You have to take a day off from work. My mother had 8 kids. So, the ability to even have the time to access it, even if you had the money, mm-hmm. was problematic. And, as we move forward, those are still the same issues that we're dealing with today. We're dealing with communities of color that are exposed to more mm-hmm. in terms of environmental not clean air, not clean water. And then you have an environment that these people don't have, a lot of them don't have insurance. Or you have Medicaid. And I know for a fact that Medicaid, in terms of the hierarchy, the quality of care sometimes you get with Medicaid is not the same. Where you live is important. And I think that we are seeing the effects time and time again that what outcomes to expect have more to do with your zip code than they do with your genetic code. So when I look at healthcare disparities, I think of it this way. I think of what are the things that the systemic things, the social determinants of health, everything that is outside of the individual, which affects your outcome, mm-hmm. because that is the real driver of healthcare disparities, not individual behaviors.
Mm-hmm. Yeah, I think that is such an important point. And it's kind of like these two issues are compounding each other. Like these communities are facing more exposure to pollution and to climate change. And then the healthcare infrastructure in place is also not reaching those communities for all the reasons that you just mentioned. Because of those disparities, what are some of the main health issues that are impacting women of color, both in their health and also their reproductive health? Or what are the things that come to mind?
Oh my, how much time do we have?
Yeah, that's a big
Everything.
question.
Everything.
Yeah.
And it's funny because when I write about maternal health, and I think that it illustrates a very important point, is that when we talk about outcomes in maternal health, and everybody knows the figures that for maternal and infant health, for Black women in this country, the maternal mortality rate is 2 to 3 times higher than it is for white Americans. Here's the problem, is that we act as if that's an isolated event. One of the reasons why the maternal mortality is as high as it is because Black women enter pregnancy in poorer health than their white components because of the burden of chronic diseases, be it asthma, be it hypertension, be it diabetes, be it obesity. That's how we enter the game. When you get to that point, you have to say, okay, well, then there are the maternal mortality, and then there is the increased morbidity of pregnancy itself. So all your near misses or the chronic diseases that you carry with you through pregnancy, those, even though they may not affect your pregnancy at that point, if you have pregnancy-induced hypertension, if you have diabetes, pregnancy-induced diabetes or gestational diabetes, if you have preeclampsia, those things are also markers and drivers of poor health moving forward, even when you are not pregnant. So the through line that I try to run through these health care disparities is that the same things that drive poor health outcomes when you're not pregnant affect your pregnancy and will affect the rest of your life. And so to pluck one thing out and say, well, if we just fix this one thing, that's going to solve the problem. It will not. What I think that the bottom line is, aside from, and there are the environmental stresses and everything that Black women face, from economic instability to, not having, fresh outdoor space, being in a medical desert, not having, access to healthy food, all of that is going to continue and it will follow you for the rest of your life. And I think that we sometimes, in this country, like to blame individuals for systemic problems. And because it lets you off the hook, it lets you not solve the big things, because you say, well, if you would just stop doing this, if you would just exercise more, if you would lose some weight, the list goes on and on, then, it lets you focus on the individual and you missed, you missed the forest for the trees. Absolutely. And that's sort of where we are with health, with women's health generally.
Mm-hmm. Yeah, a few things you said there stood out to me. Like, I know preeclampsia, extreme heat, and air pollution actually increase the risk of developing preeclampsia or is linked to preeclampsia. And we know that women of color are also facing more exposure to heat and air pollution. So there's a lot of connections there. And yeah, what you were saying about even access to healthy food. This woman that I've been talking to in Pritchard, she's like, we were growing our own food at one point in time, but the water system, our water is so contaminated right now that we can't even do that. And all these things are related to then people's health. So I think those are really important points.
And let me say something. Pritchard, Alabama is not rural Alabama. This is not where my mother grew up, in the middle of what's called the Black Belt, where they too have a very severe problem with their infrastructure there. And they actually, and I just saw something last couple of weeks ago where the government is now discontinuing the program that is trying to get clean water, because these people do not have a septic system. So they're doing straight piping, which means all the wastewater from their house is going right out into their backyard and into the well water that they drink. Now that's a problem. But Pritchard, that's, you can say, well, it's rural Alabama, right? Pritchard is as close to Mobile as Bethesda is to Washington, D.C. It is just outside. But what it is populated by is that it's predominantly Black people. They're poor. There's, the city infrastructure is not there. And for the state of Alabama needs to step in.
Absolutely.
And they have not. It's unconscionable.
Yeah, absolutely.
That, we're in this situation in Pritchard, Alabama. But I'll tell you one other, because there are many communities like this, but I don't know if any of you have heard of the, the slave ship that was found, the last slave ship that came into Alabama, it came into the United States, came into a little community. It's called Africatown, which is right near Pritchard, that whole area. the descendants of the people who came in on that last slave ship, and you can look it up. It's the Clotilda. Okay, they've found the last ship came in Alabama, but these descendants who were the last Africans who actually came into the United States, they came in 1860. So these people, then the Civil War broke out, and by the way, they reconstituted a community right outside Mobile, near Pritchard. The conditions that these people live in, and it is now a cancer alley. Yeah. Because chemical plants, when they're deciding, these are decisions that people are making about, I'm going to put a toxic chemical plant. Where should I put it? Well, they're certainly not going to put it in the area of town where wealthy people live. And so this community, in addition to everything else they've endured, the land that they've had that for 100 years has now been sort of broken up by a highway, and now with all these toxic chemical plants around them.
Yeah. It's unfortunately the story of so many communities across this country. And it leads me to something else that was in your book that really stuck out, because I think we don't always talk about it as much, or it's maybe not something we think about as being part of health. But you have I think it's a whole chapter on chronic stress. And yeah, when you're talking about living in a community where you're having to deal with all these external factors, and I think to some degree, maybe we're all dealing with chronic stress right now. I know I am, but I think we sometimes forget that has real health implications. And I was wondering if you could talk a little bit about those and how that impacts women of color in particular.
Well, when I say stress, and I mean, stress can be from any number of sources. It can be, economic instability. It can be the fear of imminent danger because your neighborhood is unsafe. It is worrying about your children. It is having all those things that sort of get you going. It is macro and micro aggressions in the workplace. It's toxic relationships, all of that, which disproportionately affect women of color. Well, here's the problem with chronic stress is that we know what it feels like, and acute stress is good. You got to run from a burning building, when the situation requires it. Chronic stress, which is feeling that activated all day, every day, is a huge detriment to your health. It is a condition that in medicine, we call it the allostatic load. Just what is the physical manifestation of you being that stressed all the time? There is a psychologist, social scientist, I think, at University of Michigan, Arlene Geronimus, who writes about weathering, this concept of what does the experience of living in a stressful environment do to you physically? And that's why she coined the term weathering, because it's just like you're exposed to more things, and it literally wears you down, just like paint off of a barn if you live in a harsh environment. It's true for Black women. It's true for poor women who live in Appalachia. The same thing. You look at them, we are aging faster. We are damaging our internal systems faster. And that is having manifestations, not just on you psychologically, but physically as well. And that is what we have got to learn to address and to say, all right, because the solution to that isn't, do something that you don't have the time or the resources to do. It's dealing with that and figuring out how to relieve some of that. And in Washington, D.C., let's say this, we are not dealing necessarily with that, but we also, as women of color, certainly in the workplace, are dealing with stress in the workplace. We're dealing with all those other things. Women in the workplace, how do you deal with juggling work and children and paying bills and traffic and all of these things, which understand that there is a definite mind-body connection, and that unless and until we really sort of address that and how we're able to deal with it. Now, we can't always control the stress in our lives, okay? There's going to be stress. But what we do have to realize is that we have to avail ourselves of help, and understanding that suffering should never be your resting place. So however you do it, whether, whether it's through mental health services, whether it's through your minister, meditation, whatever it is, understand that walking around in a chronic state of stress is never going to be good for you physically or mentally.
Thanks so much for that. Yeah, I think it's such an overlooked part of this conversation. So I'm going to take a little bit of us into a different direction. Something else that comes up a lot in your book is the lack of research on women's health and the role that it can play in closing some of these health disparities. Right now we're seeing the National Institute of Health canceling grants. A lot of those are related to women's health or to certain demographics. We know that, environmental justice, DEI, all these big words are being used to kind of take away resources from some of this research. And I'm curious how you're thinking about these changes, and also what are some of these disparities or things that women deal with that you wish there was more research on?
Oh my. The funny thing is, for as long as I practice medicine, we know health disparities, like, yeah, they exist. I did not understand the depth and breadth of these health disparities and why they exist. And I think more importantly, why they have existed and why we have done nothing about them. I remember I read a very interesting book by a woman, Linda Villarosa, and her book is called Under the Skin, and she writes about, health disparities in this country. For as long as we have recorded health outcomes, health disparities have existed. So starting back in the 1890s, and I think it was the guy, Frederick Huffman, wrote this paper. And because the outcomes for Black people, and this was in the rural South, were so disproportionately worse. This is where this notion that, well, then it must be something wrong with Black people. So he actually, lectured about this, and he talked about the inferiority. Like, what is it about Black people that makes you peculiarly more susceptible to death and disease? Well, when you start from that place, and again, it goes back to blaming the individual versus blaming the environment. That's where we start. It was such a big deal at the time that W.E.B. Du Bois did a response to this study about Black people and disease. And he said, he went to the South, interviewed over 2,500 Black people. And he says, you know what? It's not the Black people. It's where they live. It's what they eat. It is what they're exposed to. That was in 1925. So what we now know as the social determinants of health, we've known that for 100 years. But what have we done about it? And we in medicine, I think that we do a very good job of describing things. So we talk about, you can pull up any statistic, anything, and you will find that health disparities persist, that terrible 2 to 3 times factor that you have to apply to anything, to hypertension, to cancer, to maternal mortality, to infant mortality. It's there. We have not addressed it. And why haven't we addressed it? Because I did not realize how few resources are actually dedicated to women's health. When I was doing the research for the book, I found out, I said, well, let's pull the figures, and as of the writing in 2022, I had NIH, which is the largest funder of medical research in this country. They then had a $45 billion budget. Of that $45 billion budget, less than 11% of that went to diseases or conditions that affect women, either exclusively or predominantly. 11%. And that was up from 8%. And most of that 11% was really on, breast cancer. Some of it, they were just starting to get around to maternal mortality stuff. We were not looking at the things that affect women and that disproportionately affect Black women. Autoimmune diseases, fibroids, migraines, polycystic ovarian disease, everything that women experience, no one's looking at an answer. So you want to know why these things continue. We see them again and again and again. It's because not only are we not researching them, but we're not even implementing the solutions that we know that would help, like plain old access to healthcare. When it comes to maternal mortality, again, something that I found pretty surprising. One is that almost half of the maternal deaths happen outside the hospital. Outside. So you've had a beautiful delivery, everything went well, you're home, and then 50% of those deaths will occur outside the hospital. Well, does that not tell you something about how you need to follow up with women after they are discharged? It's not enough to just be there and say, okay, you're fine, go home. And it was standard practice, certainly for most of my career, have a baby, see you in 6 weeks. So these are things that are easy. They're easy. And yet we don't do them. And when it comes back to the issue of diversity, which is now, a verboten word here in Washington, D.C., the reason why diversity in the research is important, it's important because the researchers who are doing it have to have the curiosity about these things. But they're not crazy. They're going to do research on things that you're going to get funding for. And if no one's interested in fibroids, if no one's interested in, I wonder why women have more depression and anxiety, why women experience menopause, and particularly Black women experience menopause differently. If you're not curious about that, and even if you are, when you go to NIH and you get denied, then you're not going to study that. So that's why I said so much of the state of what we know now is we're at a standstill. And what's horrifying to me is that even as we were starting to get a little traction, we were just starting to, because part of it is just recognizing that something exists. Name it, claim it, and then let's go do something about it. We have been content with just like, let's just describe it. Isn't that interesting? Oh, isn't it interesting? Black women and white women get cancer at the same rate, but Black women are, twice as likely to die. We're not at a lack of solutions. What we lack is the will, the political will to do the things that we know that we need to do to improve the health of women, and particularly women of color in this country. And that's why I think it's so important, the work that you do at Moms Clean Air Force, is because you are raising awareness and making sure that someone is there to advocate for women, even when they don't know how to advocate for themselves. Because outcomes are more, I think that we have to understand that this is policy. It's not destiny and it's not genetics. We're making policy decisions that harm women's health.
Thank you so much for that, Dr. Malone. I think we are getting short on time. And I wanted to end, I know these conversations can feel a little disheartening, but your book gets to a lot of things also that women can do to advocate for themselves. And as you mentioned, this is not an individual problem. We are up against these systemic issues that are part of our society right now. But yeah, how, for people who are watching our conversation today, either in this room or at home, what advice do you have for women who are navigating these systems and, who need in some ways to be their own advocates?
Well, I talk about two things in my book, and one is what I call little a advocacy. And the little a advocacy is how do you as an individual show up and advocate for yourself in a one-on-one situation. But then I also talk about the big A advocacy, and is the work that you do. It is the work that I've been doing out here on behalf of women in midlife. because again, I don't want to leave anyone with the way that we've been left before. It's like, oh yeah, it's terrible, isn't it? Oh, no,
Bummer.
it's terrible because one, most of us weren't aware. Okay, now that we are, the next question is, what are you going to do about it? And I think that what's been encouraging for me, certainly when it comes to women in midlife, is that we now have to deal with the reality is that we cannot count on the federal government to be a reliable partner. That's one. So does that mean you do nothing? No, it does not. It means that you advocate either through private sources or you go to the states. You go to states and your local government because, again, these are avenues that we can use. These are levers. Write your Congress people. Write your senator, say that it matters because they're like any other issue. Whether or not they're going to respond depends on how much you demand from them. So I think the hopeful thing is, we can't say, let's throw up our hands in despair. I think that we individually have power and collectively we have more. And this is an issue that it's not partisan. Because in the rural places in this country where they've closed hospitals, this affects more white people than it affects Black people. So we've got to make that message, I think, a little clearer, because once you look at it from just a racial prism, it's too easy for people to turn away and say, that doesn't affect me. So that's our thing. Do something.
Well, on that note, thank you so much, Dr. Malone, for sharing your insights with us. Yeah, incredible to hear from you. And if anyone is interested in the 19th, check out our reporting. We report on these issues as well. So we're happy to be media partners today. But thanks again, Dr. Malone.
Thank you.
And now for the panel, how dirty air, toxic chemicals in plastic, and extreme heat are hurting pregnant women of color. Please welcome the founder and CEO of New Health and our moderator, Priya Bathija, and our panelists, the Executive Director of Children's Environmental Health Network, Insedu Obat Witherspoon, Advocate and Program Coordinator of Moms Clean Air Force, Luz Drada, and the 118th President of the National Medical Association, Dr. Doris Brown.
So hello, everyone. I'm excited to be with all of you today to talk about this important issue. And before we get started, I just want to do some level setting. So how many of you are aware that only 20% of our health is dictated by the healthcare that we receive? Oh, very few. The remaining 80% is determined by non-medical factors related to where we are born, live, learn, work, play, worship, and age. Those factors, as Dr. Malone mentioned, are often referred to as social determinants of health, social drivers, or societal factors that influence our health. Have you heard those terms? Yeah, okay, great. And they include the factors in the environment that we're going to talk about today. So air pollution, plastics, and extreme heat, each of which are impacting individuals' health, functioning, and quality of life. And then Dr. Malone touched on this as well. We are going to connect those factors to maternal health. Y'all know we're in last place in the United States compared to developed nations when it comes to maternal health outcomes. We have a lot of work to do to improve, but we're working on it. And this conversation hopefully will provide some insights that you can all take back. The last thing I want to say is that we're going to share statistics and perspectives on Black women and Latino women in this conversation today. We know that all of these issues impact other women of color as well, including Indigenous women and Asian women. Unfortunately, there's not a lot of data when we look at those populations, which is a whole conversation for another day. So today we're going to focus on these populations and the experiences and work of our panelists. So now let's just dive in. So I'd like to start with each of you sharing a little bit more about yourself, the work that you do, and why this issue is so important. So Ense, I'll start with you.
Thank you so much. Good morning, everyone. Thank you for Moms Clean Air Force, as always, for holding an important forum. It's really important to be having these conversations and to link to related actions. Insaidu or Insay Obit Witherspoon, again, Executive Director of the Children's Environmental Health Network. I'm also coming to you with my daughter, Adia, who's back here, also interning with us. We feel it's really important to reach back and let our next generation, be right beside us, because again, we didn't get into this overnight. We're not going to get out of these issues overnight. It's really important to be doing that. I'm also coming to you as a mom of 4. So she's got 3 siblings, 21 through 9, and all the realities of what that means to be any parent, nonetheless, a woman of color, raising children in this day and age, between gun violence, climate anxiety, lack of, we have lots of discussions about lack of valuing of human existence and on and on. It's interesting to support all that and to navigate that. I was going to be a pediatrician. I was going to go to med school, and I was going to change the world in that way. Junior year of college was a very earth-breaking time for me, much to my father's chagrin. I started looking and asking about, what about when you do what you need to do, but then you go in community? And and I didn't realize I was describing environmental contributions to our health and well-being at that time, stumbled into public health, and have been at the Children's Environmental Health Network for the last 25 years. So it's not the trajectory I thought, but my passion for protecting our most vulnerable, especially those that have had nothing to do with how we've gotten here, but are, again, reaping the worst, has always been a passion. And I look forward to diving into this conversation together with everyone.
Thanks. And Luz?
Buenos días. Good morning, everyone. Buenos días por acompañarnos aquí en persona en Washington, D.C., mientras abordamos esta importante conversación. Good morning. Good morning, everyone. Thank you so much for joining us here in Washington, D.C. to discuss such an important topic. I am Luis Rada. I am an advocate for climate justice and climate action, and I serve as a mom's program coordinator and a comadres. Of course, as a woman, as an immigrant, as a Latina, and woman of color, this mission is deeply personal to me. And that is why I'm here this morning. This is why I joined Moms Clean Air Force, and this is why I am here advocating for myself and for my community. Moms Clean Air Force and the comadres, we work to mobilize and empower Latinas communities like mine across the United States to fight for clean air, climate justice, and environmental protections. Our goal is simple, but it's urgent: to raise awareness, engage our communities, and demand stronger protections that safeguard the health and well-being on our communities, those that are more impacted in what you just mentioned. That has nothing to do with this pollution, with this problem that we have. So one of our top priorities is advocating for maternal and infant health, especially among women of colors, women like me in the United States, who are unfortunately the most impacted, who are the most exposed to those environmental and health risks because of where we live, where we work, where our children go to school, and where they go to a playground. And that's not right. That's wrong. That's not fair. So we know that pregnancy is a time of significant changes, and it's a time of extreme sensitivity. And during my pregnancy in 2016, I was encouraged to eat healthy, to exercise, and make sure that I took my prenatal vitamins. But what no one mentioned to me is that silent threat of air pollution and extreme heat. That factors that I now know through my work that can have a tremendous impact in the developing of an infant and a baby and the health of a mom. Thank you.
Thanks, Liz. And Doris.
Yes, good morning. I am Dr. Doris Brown. I'm a medical oncologist. I am a retired colonel in the U.S. Army Medical Corps and the past president for the National Medical Association. And for those of you who do not know what the National Medical Association is, just let me give you a couple of pointers. We are the oldest professional organization for African American providers in this country. We are over 100 and we were founded in 1895. Takes me a while to get those numbers, but I think it's over 130 years. We provide services in all areas. We have 26 subspecialty areas. So maternal health has been one of those areas in OBGYN that you heard Dr. Malone speak about. Very, very important. I, with my public health background, have always been about community. And certainly serving in the military and seeing services and things that were not, well, one, I had to fight for women in the military, that we could go to combat, that we could do all the things that those guys would do. And now you have to also look at exposures. And when I look at what is going on in this country environmentally, I'm part of the Council on Environmental Health and Climate Change. And so that is very important because we are advocating for the rights of all of the citizens, but most particularly for those that are most vulnerable. Let me just also say, I am from Mississippi, so I know about the injustices that we have. Blacks, people of color, have been targeted, and this is targeted, not just by happenstance, but it was targeted, that they live in communities that are closer to power lines and landfills. And so again, their exposures are going to be higher than others. That is by design. They could not afford to live in those other areas. So that is one of the duties that our Environmental Council at the National Medical Association, advocating for the rights of people of color. And so as an oncologist, this brings me back around from public health to where we are today. The outcome of all of this air pollution and exposures that are there, many of those conditions result in cancers that we see. And so that is our breast cancer, lung cancer, cervical cancer. You just go down the list. You have all of them. And so hopefully, and I am part of this panel, I want to thank you, so that we can answer some of those questions about what's going on today. Thank you.
Yeah, thank you all. I'm so excited to be with all of you and to dive a little deeper into the experiences you've had, both personally and professionally in the work that you lead. And Nancy, maybe I'll start with you. Can you share a little bit more on how maternal health and children's health are connected when it comes to environmental exposure?
Sure. We'll do this as quick as we can. The whole premise and the mission of the Children's Environmental Health Network is to be a beacon, if you will, a voice for children when they're not able to be in the families that serve them, and to just make sure that we are promoting the safest, healthiest environments to nurture the true potential of every child. And we are not there. As far as air pollution, water pollution, food exposures, and built environment as major exposures. So just honing in on our air. The womb is the first environment for a child, mom's womb. So what we do know is that these pollution, these metrics, including even heavy metals and other exposures, do cross the placental barrier. So what we are now seeing is not only 1 in 5 deaths globally around the world attributed to poor environment, specifically air pollution is a big culprit. And I've read reports of up to 2,000 deaths a day across the world. That is completely unacceptable. Children don't even get a chance, right? And then you have all the challenges in carrying that child between rising heat index and air pollution that women go through. But we also have situations where now we're seeing what grandparents have been exposed to. So potentially occupational exposures, or where grandparents grew up and spent a lot of time, those traces of those specific air pollutants and other chemicals showing up in their newborn children. I mean, this is where we're at. Every child is born pre-polluted in this world. So again, if you are any child, that's already very challenging. If you're a Black and brown child in this world, and especially America, that is an additional challenge to overcome. And then there are stages of vulnerability. So we do know that there are various organs developing at various stages during the prenatal growth period. Anytime a type of substance, a chemical of any sort, especially an air pollutant in this case, is entering that young developing system, there is harm to the natural growth and development. So we're talking the growth and development of lungs, the brain, the liver, all the major organs, but especially we all know from, for example, research out of Columbia University, you could be a healthy child and you can live near a high thoroughfare about 500 feet roughly, and now have onset of asthma. And that's for an adult too. So we have adult onset of, we have people who have been relatively okay dealing with other chronic illnesses and now have adult onset of asthma. A lot of that is attributed to where they're spending a lot of time. And we also have this case of young Ella Deborah, 9-year-old in the UK. The first case that we're aware of where the death certificate, thanks to a decade of fighting from her parents and her mom with the UK government, indicates air pollution as the cause of death. And a lot of discussions in that, and now she's suing the UK and all that, about the fact that they are in a low income community, and vehicular traffic and that whole conundrum. Is this where we're at? Are we going to continue to wait for death certificates and the incredible harms to the quality of life of children, impacting a range of issues that we've been talking about already? And then, so that's the baseline. And then you have, what are the major causes? Vehicular traffic is a big component, industries of various sorts, and the fact that we are now deregulating industry right now is not the way to go. We're going backwards for sure. Agricultural production, and now the rising threat of wildfires. So climate change is impacted by air pollution, but it also exacerbates air pollution. So then what are we talking about as far as exposures? We're talking about stillbirths in children. We're talking about spontaneous abortions or miscarriages. We're talking about preterm labor, birth defects, low birth weight. So again, if you are a child born with low birth weight or birth defects, again, it's creating not a death sentence, but a much more challenging road, and not even getting into the other health disparity indicators that we've been talking about already. Increased wheezing, respiratory illness, decreased lung function and development, increased asthma incidents and episodes to hospitals and visits, increased neurodevelopmental disorders, decreased IQ, and risk of pediatric cancers and other chronic illnesses. So we do a lot of work in the cancer prevention space when it comes to environmental exposures. What I can tell you, we have a report on with many partners out here about the major culprits of existing science, just looking at what is available to us. Vehicular traffic, pesticides, paints and solvents are the major contributors to different forms of pediatric cancer. I believe many of them can be prevented. So you don't have to find a cure if you're preventing it in the first place. Yeah, I think that's all I'm going to say on that for now.
Well, I have another question for you. I think it's very fascinating that we're all born pre-polluted. That's a really scary thing to sort of take in. But then as we live, we're exposed to even more pollution. And we're also exposed to plastics, right? We use a lot of plastics in our day-to-day lives. How does the production, use, and disposal of plastics contribute to the health burden that we face?
Thank you. So the plastics industry is right there with the fossil fuel industry. It actually has its base right there. We have been kind of marketed heavily to understand that plastics are part of our enhanced daily life and our conveniences, and we all benefit from them. I'm not discounting that. I remember recently in the last couple of years seeing a huge uptick of marketing and commercials. Maybe you've seen it. The young child walking down the street and their sneakers disappear on their feet. People playing tennis and the tennis racket disappears in their hand. Or the young child in the ICU and all the tubing. And then the tagline is, plastics is part of our life. You know, what could we do without plastics? That emotional connection, this industry has been working really hard, like the fossil fuel industry, to make us understand we need these products. I'm not discounting that we don't benefit. What I'm saying is that we need to do a much different way of engaging and reducing the creation of them, the lifespan of our contact with them, as well as how they are dispersed. Because we also understand now plastics are not being recycled, are not able to be recycled, a good amount of them, like we originally were taught or told. So just quickly, the foundation here. Toxic Waste and Race in the United States was a report commissioned by the United Church of Christ in 1987. That was a really first time indicator for the rest of us in the United States to see the mapping of where major industrious polluting sources were, and the fact that they overlay with most marginalized, underrepresented communities. Fast forwarding to about our COVID pandemic, I had the honor of working with Jackie Patterson with the Chisholm Legacy Project, and we wrote a piece called The Hand That Rocks the Cradle, talking about how this endemic impacts Black and brown children the most. COVID, climate change, and disinvestment in communities. Sadly, the story is still the same, if not amplified, because now you have these industries emerging over the course of generations, and you have the compounding cumulative impacts of what that has meant to us. So this industry has been so bold to not do this in the quiet quarters of the background rooms. They're telling us that they are going to increase production 3 times in the course of the next couple decades. And they're going to put incinerators in the communities most marginalized that have been indicated in the Toxic Waste and Race report. So they're telling us we're going to do this. We're going to harm everyone, and we're going to harm the most marginalized. That is completely unacceptable. And they're using terms like advanced reaction and sustainable recycling. It's just code for we're going to put incinerators, we're going to burn these plastics, which is going to create more pollution. So what we're talking about is a range of challenges that are also impacting our digestive, our reproductive systems, and our reproductive systems. So impacting your lungs, impacting your liver, impacting your brain. We're now seeing microplastic, little pieces of plastic showing up in the carotid arteries of 55 to 65-year-olds who are presenting with cardiac arrest. This is now a regular. So our cardiac issues among women, especially Black women, is only amplifying further by this exposure. Also, cardiovascular disease and the epidemic of 47% of Black women dying, as was been talked about, from cardiac illness. There's a lot of ranges and reasons, and the stressors we've been talking about. We cannot forgo the fact that the increased connection to plastics in our daily life is a big part of that. Children are also not immune. They're exposed, and they're exposed throughout the lifetime. You know, maybe many of us didn't have as much interaction with plastic as we do today. I don't know about you. I go to the grocery store, instead of just picking up a regular cucumber like I would like to do, now it's all prepackaged in a plastic container, because I guess picking up 2 is too much. So they got to put 2 in a package for us. So there are actions, right? There's lots of different ways we can do our own audit, while many of us are out here, including moms and Children's Environmental Health Network and many groups, trying to make sure that we have policies that don't allow these products on the market in the first place, like other countries have done. We're not there yet. So in the meantime, we have to take control of our own exposures. Let's think about those little pods, the laundry and the dish pods that are coated in plastic. Unnecessary. Just look for the soaps that don't have phthalates and plasticizers in them. What about single-use products and plastics, like all the water bottles that are marketed to us because we're told not to have confidence in our water system? Well, we should carry around our water bottles like many are doing and reuse them. Let's not use the plastic bags. Let's bring our regular, reusable bags to shopping. What about cosmetics? There are a lot of phthalates, which is a plasticizer in our cosmetics. So we do have to do the work of looking into some of these products that we're putting on our bodies every single day, lotions, hair products, and making sure that we find a line that we're a little bit more confident in, especially those products being used on young children. And finally, clothing. 60% of our clothing is synthetic, nylon, spandex, polyester. So they're shedding microplastics as we wear them. It's deep. You can't even make this stuff up. So ideally, you want to look for 100% cotton. So there are a lot of different other ways, but cookware, thinking about non-stick cookware. So there are some tangible ways that we right now need to be educating ourselves, educating our communities, while the larger policy development needs to happen, so that among all the stressors in life, this does not have to be one of them, thinking about every single action that we take to try to reduce our exposure to chemicals and plastics specifically.
So my mind is blown as I think about the spandex in my pants, just
I've got a lot of it.
getting microplastics all over this stage. I think what's challenging, and just building on what you were saying, and say, is that we don't even realize where plastics are touching our lives. As you were listing those out, I was like, oh yeah, the grocery store. Oh yeah, my pods that I use for my laundry. I recently learned dental floss can be a risk too. So thank you for sharing all of those. And Doris, I want to talk a little bit about extreme heat. Can you share how that impacts pregnancy?
Well, certainly. Just to add a little bit to what we just heard about plastics, you also have to think about in the healthcare, the health system, in the hospitals, in the clinics, all that plastic that you have, some of it is getting to your brain. Some of that we have to look at and do research about what is the ultimate cause of this. And I should also say, for those of us that love seafood, it's polluting up our oceans. Those things that we eat, yes, they have engorged the plastics that we toss aside, and it gets into that system. You then eat it. We're sort of one community here, from the animal system to humans. And so, yes, plastics, a big, big problem. But I should say the National Medical Association will be addressing microplastics and plastics in the next administration. Now, let's go back to heat. Okay. The biggest health threat that we have to the world, to humanity, is really climate crisis. And I know if you lived in the Washington, D.C. area, or just in the United States, the past 2 to 3 years, we have had raging heat. We say in 2022, oh, this was the hottest summer that we've ever had. Then the next year, it's even worse. So we're coming on 25. It's probably going to be very high. We have even had in springtime in the DC area, 80 degrees. It is spring, not summer. But we're going to fast forward to summer and get very hot. You then have to add the wildfires that we've had in California, Canada, all of the pollutants that's coming from those fires and the heat, again, having an impact on us. For pregnant women, horrible. As you've heard, you start off in utero getting an exposure to those toxins that are in the air from the wildfires, from all of the other pollutants that are generated. And then you go on to have preterm births for some women, and that is very high for people of color, stillbirths. And then, of course, those children coming out and having asthma, that just impacts the whole thing. But we really know that working very hard, advocating for change, and Mom's Clean Air Force really working on the Hill and getting our legislators to really address this as a real important crisis. And it is a crisis. We only have one Earth island home that we're living in, and if we don't protect it, your children and grandchildren will not be able to live healthily in this environment. And so again, to address the extreme heats, we talk about one of the things, and I'm sure you heard this earlier from Dr. Malone, about the high maternal death rate for people of color, African-American women. Even in the United States, maternal death is just tremendously high. Again, it's about what we're breathing in, what we're eating, all of the social determinants of health. And so that is impacting us. And so we have to advocate for change. We have to know who our legislators are at a state and local level, as well as federally. The National Medical Association worked diligently with our council, with the previous administration, and they made significant changes about the exposures from car exhaust. So cars and trucks was one of those things that's spewing out. We talked about the extreme heat that was going on. And again, just where you're living living and getting that exposure to change things. And the EPA made some significant changes, not exactly where we wanted, but the first step. So we were on our way to decreasing this pollutants that's there. We talk about greenhouse gas. That is really a measure of what is going on. Well, deregulations are here. We're going to roll back. And the discussion was at least 31 of those regulations that were there to protect the public health. And that's what EPA's job is all about, is protecting public health. And that's all of us. And again, if we don't advocate for going back to where we finally made the difference, to begin on that path to cleaning up this environment and making our island home safe for all of us, we will continue to have the high rate of asthma. We will continue to have the high rate of maternal deaths, premature births, low birth weight, stillbirths, all of those that will impact our community. And for those that need an economic reason for all of that, to say, what does it actually mean when you start to talk about that? With the changes that we made with EPA, we could have saved 4,500 premature deaths. We could have decreased at least 120,000 asthmatic attacks. And of course, you know, asthmatics will have to go to the hospital. And of course, they have to be seen in the emergency room using some of those plastic things that were there. But it's about 3 times the attributable deaths for Blacks as compared to whites, just from all of the environmental changes. So in addition to that, you're going to have some lost days from work. You can't go to work if you're sick or sitting in the ER. And if any of you have been to an ER, you know how long it takes. If you didn't come in with a gunshot wound or heart attack, you're going to be there a while. So that's a lost day from work. And again, those numbers add up in terms of economic benefit.
Yeah, thank you, Doris. And Doris and Ense, you did a really nice job of setting the stage of all of the challenges and the way that this is impacting us in our day-to-day lives and for our futures. Luz, can I turn to you to make this a little bit personal? And you've written an op-ed about your personal experiences. Can you share a little bit more with us?
Absolutely. Thank you. Writing that op-ed was deeply, deeply personal for me because it came from my own experience navigating a high-risk pregnancy. In 2016, during my second trimester, I was diagnosed with preeclampsia, a serious condition that can have a long-term health consequences, and sometimes that can end in death. I learned through my work that condition, preeclampsia, has been linked to exposure to extreme heat and the air pollution. At that time, I was living in St. Louis, Missouri, a city that was recently ranked the 30th most polluted in the United States, according to the American Lung Association State of the Air report. What I remember the most is the lack of information I received and education I received about all the environmental risks during my pregnancy. No one told me. The heat that I was exposed to and the polluted that I was exposed, it could have such a tremendous impact in the development of my baby. In my own health. I didn't know that my health and my baby's health was such a being impacted by that. Trust me, I'm here and I remember those days and I feel my system, my nervous system reacting to that. Because being pregnant should be such a joy and happiness moment for an expectant mom. And I don't want any woman, no matter your race, ever go through that scary experience. You know, At one point, I have to see my health provider every other day because they have to monitor my blood pressure.
Luz, can you move your microphone?
Yes. I have to check my blood pressure at home 3 or 4 times a day. Just let me know if that goes, I would say, call us if that goes to 190. Do you know 190? That's scary. The normal is 120. And I was trying to, okay, let's try to relax, but I couldn't. I was so scared, like, I don't know if I'm gonna make it the next day. I don't know if we're gonna make it. That was scary. That was scary. So, and despite all this challenge, my son, who is 8 years old now, and myself, we are both healthy and thriving. My own experience motivated me to become an advocate. And that is the reason why I'm here, because I'm advocating for all the women, those women of colors that they don't know, don't understand, and they can make that connection between environmental factors and your pregnancy. I'm here to be that point of reference for some women that they need to receive this information, to get educated. I'm here to take this message and carry this message and use my voice. I know that when we breathe, there's not an option that we can say, oh, let me move here and see if I can breathe cleaner air. Unfortunately, we can't. We can't. But we can do is absolutely, we can choose to take actions. We can choose to engage our communities, whether it's through policy, community engagement, or self-education. I believe that we all have a role to play, and it's our collective responsibility to clean up our environment. So future generations not can only survive, but can thrive in healthy conditions. So yeah, I think it's extremely, extremely important that women, but especially those most impacted, women of color, are centered in the environmental decision-making.
Thanks, Luz, and thank you for sharing that experience. I think we're all grateful that you have turned that negative experience into an opportunity to advocate. And could you share a little bit more about some of the disparities that Latino women are facing and how Eco Madres is working to address those?
Yeah, absolutely. So at Eco Madres, we understand that language barrier is additional to all the layers of challenges the Latino women face in the United States. We need to add to that layer. A very important one is the language. Just imagine how vulnerable someone is if you can understand what people saying to you, if you can read a document, right? So at Eco Madres, we understand that, and we provide relevant and accessible information in Spanish for those who English is not their language, to ensure that families and communities really understand the urgency of what is happening, and they can make decisions to protect their health and their communities and their family. Additional to that, my community, people of color in the United States are overrepresented in the outdoor workforce, agriculture, landscaping, and constructions. These people face direct exposure to the harm of environmental hazards. Additional, I will mention Latino women. We have high rates of fertility rates, and we also have the highest numbers, the highest uninsured rates of any racial group in the United States. So yeah, just combining all that. I'm just gonna put an example. A recent example is the National Weather Service recently paused translation for all the alerts, leaving those non-English speaking people, including many Latinos, without critical warnings about dangerous weather conditions. Just imagine that. This can literally mean the difference between dying and survive. Just that. So at Ecomadres, we believe that the environmental justice is health justice. Last year we joined Representative Bergen, Congresswoman Bergen, here in Washington, D.C., in a press conference to introduce the resolution on protecting Latino maternal and infant health from extreme heat and air pollution. This resolution recognized the link between environmental exposure and poor maternal and infant health outcomes.
Thank you for highlighting that issue of language. I think sometimes for those of us that speak English all the time, thinking about that can be an afterthought, and it's so important that it become a forethought and not an afterthought. So our time has gone very quickly today, and we have 4 minutes left. And in that 4 minutes, I would love if each of you could share sort of in a rapid fire format, what are 1 to 2 things that this audience, both live and virtual, can do or take back to make this world better for moms, children, and really all of us? Doris, I'll start with you.
Just know that climate change and its impact on the community is all of our responsibility. What you do in your daily life, what you choose to purchase, what you choose to use is also very important. And so again, it's being conscious of where you're putting your dollars. Also making sure that you advocate for your rights. It is a right to have clean air, clean water. And it is imperative that we keep our feet on the pedal to make sure that the greenhouse gases and the soot and pollution that's in the community that you're breathing in is not there. So talk to your legislators, local, state, and federal, and make sure that the rules are there so that we can live clean, healthy lives and have a greater health outcome.
Thank you, Doris. Luce?
Yeah, thank you. So I would say, as I previously say, as an individuals, we have responsibilities. We have, we can choose, in our everyday life, what to buy, what is better for our communities, for our kids, for our environment. Try to uplift the voices of those more vulnerable. And, for us that, like us that advocate, just we keep playing that critical role in pushing for local and state and national policies that protect the most vulnerable populations. So yeah, I would say that. And finally, I would say just thank you. I am so grateful for you, because if you are here today, it's because you care about this topic. And I'm inspired by you all, and thank you.
Thanks, Luce. And say, last word.
Yes, I have deep respect for my fellow panelists. Thank you for all your sharing and and moms. I am hopeful, for example, the Environmental Protection Network is a group of former EPA staffers who give a lot of their in-kind time and are helping out a lot of groups right now and individuals. They did a poll right after the last election, which reinforces the fact that majority of Americans actually do care about our water. They care about our air. They care about all these other exposures, and they did not vote for the things that are happening right now. They actually vote to protect the EPA and its budget. So let's just keep in mind that these issues were not and have not ever been on any ballot. We need to make sure that we stay steadfast. I would suggest you align with, pick any group. There's so many wonderful groups out here at the community level, the national level, regional level. We need voices. We need people. We will activate you. If you have 5 minutes in a day, we've got something for you to do. If you're a retiree and you have more time, we will right size this. The point of connection cannot be more powerful right now. And I'm very hopeful that we will continue to get the work done. The needs and the urgencies that we've talked about today do not go away. Unfortunately, they will get harder. But the fact that we are connected like I've never seen before will be all the difference, I think, on the other end of this pendulum when it swings again.
Thank you all for being with us today. I know I learned a lot, and I continue to learn a lot from you and the work that you are doing at your organizations. So thank you again for this conversation and for sharing such important information. And thank you all for listening. And hopefully this call to action that our speakers have given you gives you some food for thought and leads to action in your own lives and at your own organization. So thank you again.
For our segment, Confronting Maternal Health Inequity in Communities of Color, please welcome Environmental Justice Postdoctoral Fellow at American University, Dr. Julie Gonzalez, who will sit down in conversation with Barbara Rodriguez, the health and caregiving reporter for the 19th.
Hi, everyone. My name is Barbara Rodriguez. I cover health and caregiving at the 19th. I cover the systems that shape how we are taking care of ourselves and our families. Everything from childcare to reproductive health. I'm really excited to be here today in conversation with Dr. Julie Gonzalez. She's a demographer and environmental justice postdoctoral fellow at American University's Center for Environment, Community, and Equity. And in particular, her research focuses on the ways in which environmental exposure intersects with systemic inequities and how that shapes health outcomes for Latino communities. Dr. Gonzalez, thank you. So I wanted to kick things off with thinking a little bit about some of the pillars of your research. Infrastructure, geography, demographics, and how that really interacts, all of those pillars, how that interacts to shape climate-related health risks. And I'm thinking about the unique effects on Latino communities, women, and pregnant people within those communities. Could you talk a little bit about that?
Thank you, Barbara. So geography plays a big role in our health. It's a space, and Dr. Malone mentioned this earlier. And as a matter of fact, as she was answering all these questions, I was saying, "Hey, that's what I'm going to say." But hey, I'll echo it. So yes, geography, the space that you live in, that's going to determine your health. And she was mentioning the black belt in her region, and then I'm from Texas. So in my region, there we have Houston with all those industries. That's another example of the place and how where you live is going to impact your health. Now we talked about infrastructure. Infrastructure deals with where you live. That's one of the aspects. Where is your neighborhood located? And again, Dr. Malone talked about this. This is in neighborhoods or areas that are close to waste or landfills or close to industries. And that's going to determine a lot the quality of health that you have. And also, not just where you live, but let's think about abandoned places. And this is something that I'm interested in. Hopefully one day I'll get funding and I can run with this. But how many of you guys have driven through abandoned places, an abandoned hospital, an abandoned prison, an abandoned funeral home even? A lot of these places are built, they pollute, and then they're left abandoned because of funding issues or just a change in ownership. And a lot of these places leave hazardous waste. So you think about the chemicals that funeral homes use to embalm bodies. Think about the hospitals, these specimens that they have, the biohazard specimens. When I relax, I like to go onto YouTube and look at urban explorers. And there's this channel that went to a hospital and a prison. And in the prison infirmary, they had syphilis specimens just there, abandoned. Now think about this. Looking at climate, we have climate shocks like wildfires. We have floods. Imagine these specimens laying there right now. Nobody's touching them, but when a flood comes and it displaces these specimens, these bloods, now they're getting put into the public. Maybe they're put into a river. Maybe they're put into a playground where kids play. And if you guys have kids, you know they're going to see something. They're going to touch it. Their babies are going to put it in their mouth. That's the public health risk. It's invisible. And also, a lot of these places have stagnated water. This is water that just builds and stays there for time, for years, and then it has bacteria growing in there. And I've seen in these videos where kids, teenagers jump into this water, and at the end up going to a hospital, having brain damage because the bacteria in there goes into their brain or goes into the system. And again, think about it. If you have a flood coming in, it displaces that water. Now that water is into the public general area. It's in the grass that you walk on, where your dog or your pet walks in. It's in our air. So infrastructure they all play a role into our health. And then you mentioned demographics. Yes, our education, your level of income, the language that you speak, they all play a role into how climate, the environment impacts our health. Our real lives don't happen in silos. They don't happen in isolation. All these variables are happening together simultaneously, and they impact us, but they don't impact us all equally.
I want to spend some time here thinking about the deeper structural drivers behind inequities that your research looks at. And again, thinking about this through the lens of reproductive health, if you could still just talk a little bit more about that.
So yes, you have everything that I just mentioned. And then you have a lot of the communities that are placed around these areas, those neighborhoods located near to the pollution sources, are your vulnerable communities. And then you have, in those vulnerable communities, you have even a new level of a vulnerable population, which is your mothers, your Latina mothers, your Black mothers, Native American, everything else. They're getting impacted because they're breathing in this air. You're probably drinking this contaminated water, and that impacts maternal health and also the child's health.
So I'm thinking a little bit about the ways in which work is driven by the personal and the lived experiences. And I wanted to ask, what brought you to this work?
So I have two main reasons. The first one is I grew up as a migrant farm worker. My family migrated to the fields of the Midwest, picking cucumbers, detasseling corn, asparagus, the whole produce aisle. That's us. We picked it. And growing up, I would see constant exposure to pesticides. I would see my mom and other farm workers picking up cucumbers from the fields, and then you have a tractor spraying pesticides right next to them. Now, for me, my mom would tell me, go to the car, don't exit. As a kid, I didn't like that because it meant I had to stay inside the truck all day long. There was a story where my mom shared, and I remember where a woman who was working in the field ended up losing her baby because of the constant exposure to these pesticides. And this is a woman who didn't know English, wasn't documented. So she had nowhere to turn. And the pain, the health impacts are not just physically. It wasn't just her losing the baby. She also fell into a depression. So mental health is also a big part of this climate change, health, the environmental hazards, and public health. She ended up leaving back to Mexico, and we never heard from her. That was how big the depression was. And the second driver is, in my younger years, I would backpack. I love going backpacking. So I've done backpacking in 5 out of the 7 continents. And everywhere that I went, I noticed a common denominator, and that was the environment. The environment was impacting individuals' health. For example, in Vietnam, I saw the effects of Monsanto. Even though the Vietnam War was in the 1970s, 2014, that's when I went to Vietnam, I still saw people being born with deformities because of the Monsanto, Agent Orange. When I went to Laos, that's where I learned how to ride a motorbike. And the kid, he was like 12, 14. He was the one that was teaching me how to ride the motorbike. And he told me, you can practice around this area, but don't go into that field of grass. And I say, why? If I fall, it'll hurt less. He said, no, because there's landmines over there from the war. So we avoid that area because people end up stepping on it, and that hurts us, kills us. In China, where I used to live in Shanghai for a year, I saw air pollution at a level that I had never seen it before. One day I went to go visit a friend that I had in Beijing, and our plans were to visit the Great Wall of China and other tourist locations. But as soon as I got into Beijing, the air pollution was just so heavy. You could feel it, you could taste it, you could lick your lips, and you could feel that texture. You could taste that smut. And I was sick for about 2 to 3 days. So my poor friend was playing host and nurse at the same time. And when I got back to the United States, I said, I've seen these hazards. I've seen how the climate impacts people. And again, like Dr. Malone said, you're not going to change anything by standing on the sidelines. So I decided to go into my PhD program in the middle of the pandemic. I didn't know the pandemic was going to happen, but it happened. So that's why I'm here, and that's my passion for that.
Thank you for sharing that perspective. And I'm thinking now about kind of thinking through the policy dynamics here. And I'm thinking about policymakers not just in the halls of Congress, but also in state houses around the country. What are policymakers missing in this moment, particularly just thinking about the environmental health challenges for not just the Latino community, but communities of color, and in particular, thinking about it through the lens of pregnancy and caregiving? What are policymakers missing?
One of the things is overtime exposure. So I recently talked about me going to Beijing and experiencing air pollution, and I got sick. That was just me being there a week. But imagine living in a location there for a year, 10 years. That's where you live. That's where your grandparents are. And exposure impacts your health. So we have a sociologist and demographer, Dr. Janelle Sparks, who studied the stress on allostatic load, like Dr. Malone mentioned earlier, and how that impacts maternal health. And she found that it plays a key role for the groups of Native American women and for the Black community. So not only does allostatic load impact your health, then you combine that with air pollution over time, extreme heat over time, and that you are already impacting in so many ways a vulnerable population, such as your Latino or Black communities, especially the mothers, their health, and the children's health.
I want to briefly touch on disinformation, misinformation, inaccurate information that's shared either intentionally or unintentionally. Thinking about this through the lens of being a health reporter who's writing a lot about the measles outbreaks that are impacting multiple states around the country, and how parents are having conversations about whether to vaccinate their children, and the information that they are gathering in those decision making. I'm thinking about how disinformation impacts public health right now. And so in particular, I'm thinking about just how it's compounding environmental health risks in Latino communities, and in particular, reproductive care.
So the thing about misinformation is that it is discrediting scientific research, especially when it comes from leaders of certain agencies or even political leaders. And these leaders discredit the work that we do. And even in the current news, we were called a religion, a climate change religion. And I take offense to that because I didn't do 21 years of school to do religion. What we do, what I do, and other scientists do, we collect data, we do statistical analysis, we do research, we do peer reviews, so that we can get these findings and give them to you, the public, to you, the reporters, to the policymakers. So why? So that policymakers and organizations can use this information and also advocate, like Moms Clean Air Force is doing right now. Moms Clean Air Force is getting data and sharing it with the community on this particular topic, maternal health and children. But when we don't have correct information and it spreads around through social media, and you have leaders of organizations that are supposed to take care of the environment, this adds another layer of risk and hazards to communities that are already vulnerable. And you have space, you have infrastructure, you have social demographics, and now you add misinformations to mothers and their children. That just exacerbates this public health issue.
This was brought up in a previous conversation about, in general, policy rollback. And so I'm thinking about the new administration. I'm thinking about regulations, oversight, rollbacks. What are you seeing right now that you think is worth talking about, and what is at stake here for reproductive health?
The loss of lives for vulnerable communities, and the future of these individuals. To relate it, I mentioned that my mom was a migrant farm worker, and I told her that I was going to do this event today, and she shared that. She said, "Did you know that I almost lost you at 8 months pregnant because I kept working in the fields, the constant heat and also the pesticides? I came to the point where I almost lost you, and the doctor told me if I didn't rest, then that was it." So she had to stop working. Luckily, she rested and I'm here, right? She had to stop working, and only my dad worked. And at that time, they were getting paid $4 an hour, $5 if they were lucky. So what does that impact? It's future. If my mom had lost me, I wouldn't be here. I wouldn't be here doing the work that I do and advocating for this issue that's important to me. It's not just statistics. If a mother loses her baby, that's that impacts your life, not just for that one moment, but for years.
Thank you for sharing. Thank you for sharing that. It continues to ground the conversation. And being mindful of the time, I want to still try to get as much information from your insights here. I'm thinking, despite these challenges, where are you seeing progress and community responses, policy wins that you could that are giving you hope? And I'll tie that to a second question here for the audience, but just what's giving you hope despite these challenges?
I like that people are not waiting for the government, for Uncle Sam to come and save us. They're taking action in their own hands. And I'll give you an example of an organization in my home state in Texas. I am from the Rio Grande Valley, so this is really South Texas. So a lot of people think that South Texas stops in San Antonio. No, if you drive 4 hours south in Texas, you'll hit the Texas-Mexico border, and that's where I call home. No matter where I go, that's where I'll call home. And in this region, we have colonias. These are neighborhoods that are not developed. These are neighborhoods that don't have a paved highway. These are neighborhoods that don't have proper water infrastructure or even lighting, street lighting. So these are neighborhoods that at night are dangerous because no lighting. You have if it rains, the streets are not paved. And there's an organization there called Arise. And Arise, what they did is that they empowered the women of these communities. They gave them training and certification so they could be called promotoras or public health aides. And these promotoras, they have something that we don't have here in DC, is that they have the public's trust because they live they live in that community. They're hey, you're my neighbor from the 2 streets away or 3 houses down. So these promotoras, with their education, with their certification from Arise, they go into the communities, they knock, and because they know the people there, the doors are open to them. Hey, what's up? Hey, we're going to talk to you about maternal health. We're going to talk to you about walking. We're going to talk to you about eating healthy. We're going to talk to you about safety. Hey, let's get together a group of community members. Let's have a chat just like this. And because where I'm from, if you're gonna do that, you need to put carne asada or that's your cookout, your food, and it doesn't become a formal setting of okay, we're gonna go learn. It's more of a hey, va a haber carne. There's gonna be food, va a haber chisme, and let's see who goes, and that creates a special environment for the community. It makes them feel safe, especially in this climate of fear, where people from vulnerable communities are afraid to come out or even interact with public research because of fear of deportation, fear of the families being separated. So it's important for these promotoras and this organization empowers people within their community to educate them and create community. And to me, that's more powerful than any congressman. No shade to the policymakers here. Again, they have that trust.
I know we're out of time, but a really quick 20-second response of just for the folks in the audience, how can they stay involved, get involved, stay informed, support the work of improving reproductive health outcomes in communities of color?
How can they stay involved?
How can they get involved and stay informed and just walk away today with a to-do list?
Well, first of all, follow Moms Clean Air Force on your social media. Okay. Yes, be involved with organizations like this because Mom Cleans Air Force has so many outlets, and you guys aren't the only ones. I know there's more organizations, but follow organizations like that. You don't have to come to DC and do a march or even run for Congress. Things like being active, being a mom's Air Force mom, being something like a promotora, being active in your neighborhood. For me, at least, I decided to go ahead and add more years of schooling to my life and become a research scientist. Note, before this, I didn't have social media. I don't like putting myself out in social media. I don't like taking pictures. I don't like being around people. But, I like my solitude, but now that I'm here in this space and I see that need, I can't be in the sidelines. I can't be hiding behind my comfort. I need to step out of my comfort zone and be active, not just in research, not just in the work that I do at American University, but in community engaged events like this event that Moms Clean Air Force is doing. So that's just one example.
Dr. Gonzalez, thank you so much for sharing your expertise today and grounding us in thinking about the data and just to help understand these critical issues. And if anyone in the audience wants to learn more about the 19th in terms of our coverage on everything from climate to reproductive health to caregiving, please visit 19thnews.org. Thank you.
Please welcome the Associate Vice President for Public Engagement for Moms Clean Air Force and Director of Eco Madres, Isabel Gonzalez Whitaker.
Good morning. It's still morning, right? I feel like we've gotten so much information. It could be 6 o'clock at night. This has been incredibly inspiring and informative, and I can't thank you all for joining us. I'm Latina, so this is all extremely personal to me. I think about Latinos who, like me, are 3 times more likely to live in areas with the worst air pollution in this country. I think about my abuela, my grandmother, who worked for years as a radish farm worker in rural Florida and pesticide exposure. And I think about the cancer she died of. I think about my family now. We live in Memphis, which has the highest rate of children asthma hospitalizations in the state of Tennessee. And just a few miles from our house, Elon Musk has opened Colossus, XAI's massive, colossal data center, which is using no less than 35 gas turbines. That's enough to power an entire city without permits and unmonitored. I think about the week last month that I spent with my son in and out of emergency rooms, him gasping for breath, and on nebulizer treatment after nebulizer treatment. Memphis already gets an F grade every year for air quality. And now XAI is emitting tons more pollution into the air that we breathe and that our children breathe. One doctor in one emergency room told me he had seen more first-time wheezers like my son than ever before. This is the reason we do what we do at Moms Clean Air Force and Eco Madres, where we take lived experiences and science and policy, and together with 1.5 million moms, dads, and caregivers around the country, and work to protect families from air pollution, from climate destabilizing emissions, and toxic chemicals. We've provided thousands of testimonies to EPA and Congress. We've delivered hundreds of thousands, almost 200,000 last year alone, of messages and signatures to the White House, EPA, Congress, and state and local officials about clean air and climate protections. We've held thousands of meetings with elected officials, and our fact sheets, I'm very proud to say in Spanish and English, have been downloaded to the tune of 60,000 last year alone. We've supported 2 congressional resolutions on air pollution, extreme heat, and children's health. Our work is working. We've helped stop petrochemical advanced recycling plants from opening. We've helped get toxic mercury out of our air. We've helped shut down 300 orphan wells. located near homes and playgrounds. We are proof civic engagement works and that democracy and climate and children's health are inextricably linked. However, we know that not all administrations are friendly ones to these issues or to our children's health. I'll give you one clear example. Air pollution had come down 77% thanks to a Republican president, Nixon, and the Clean Air Act. For the first time in decades, air pollution levels rose during President Trump's first administration term, translating to 20,000 unnecessary deaths concentrated in states, unsurprisingly, with more industry and less public health and environmental protections. And that's why we keep working, no matter who is in charge, leaning in where we can to push doors open. We strengthen ties with folks like the brilliant woman you will hear from next. Dr. Jalone White Newsom was the first federal chief environmental justice officer appointed to serve at the White House Council on Environmental Quality, where she led the first Office of Environmental Justice in the White House under President Biden. It gives me chills. Her work and expertise helped advance the single most ambitious environmental justice agenda ever in the history of this country. Mom stood with her then, and we applaud her tireless commitment to policy that improves health. And we are honored to have her here today. Please welcome to the stage, Dr. Jalone White Newsom.
Good morning. Oh gosh, I need some more energy. Do y'all need to stand up for a minute? Please do, just stand up. We are human. You can take 10 seconds to do that. I tell you, thank you so much for the kind introduction. It is always a pleasure to be back in DC. As mentioned, my name is Dr. Jalone White Newsom, or Dr. J, because I used to be a hooper back in the day. So you call me whatever and I will respond. So I want to appreciate all of the speakers, Dr. Malone, the amazing panel, Dr. Gonzalez. I mean, you have done the hard work for me. So thank you for your work and sharing your story. I mean, it's amazing. So when we think about, again, and talk about the health of people and our planet, we got to remember the original caregivers of this land that we are on today. So we have to acknowledge the Anacostan people and the Piscataway people, because we know way before we had fancy terms like climate change and sustainability and resilience, they were doing a better job taking care of the earth than we are now. And I have to also acknowledge again the ancestors, my ancestors that sacrificed and made a path for me to be able to do this work, because I know and I'm reminded every day that none of us got here on our own. So for that, and knowing that this little brown girl that came from the streets to Detroit, from Detroit to the suites in the White House, I am so, so grateful. And now that we are in the month of May, I must give some love to my mom and my stepmom and all of the women across so many movements over the 3 decades I've been doing this work that have poured into me. And again, showing me how to love, how to be patient, and how to care for your community. And so even though I might not know every mommy in this room or virtually, I just want to say to you, thank you for the work that you're doing, and happy pre-Mother's Day. Thank you, Almeda, and the entire Moms Clean Air Force staff for the invitation to be here. Yes, let's celebrate. And creating this forum, I mean, you think about the 14 years that Moms Clean Air Force, if I did my math right, has been doing this work with millions of parents across the country in 29 states, again, to advocate for better policies for air and water and climate. You are truly a force to be reckoned with. So I want you to appreciate that. And I think it was back in 2013 when I was first introduced to Moms Clean Air Force. I remember when my then 4- and 7-year-old daughters, Ari and JJ, donned their red Moms Clean Air Force t-shirts. They made some posters and participated in the first play-in in downtown DC. And after that play-in, they got the chance to talk to the then Environmental Protection Administrator, Gina McCarthy, about the importance of clean air. Now, they were both a little tired and a little shy, and I think JJ actually fell asleep in my arms, but it was important to me that they understood how blessed they were to live in a home, to live in a community where they could breathe without the fear of inhaling stuff that was hazardous to their health. And so the next couple years, my girls continued to be advocates, and they testified at their first Environmental Protection Agency, EPA, hearing about the then Clean Power Plan, that thing that was supposed to reduce pollution from coal-fired power plants. They then went on to participate in their first climate march in New York with thousands of folks fighting for climate justice. Those were milestones. And as I reflect and literally look up to my daughters, who are now both 6 feet, I have seen, again, the manifestation and the importance of pouring into our youth. And it's so wonderful to see Nsei's daughter here, because when we pour into our children early about the values and the reasons that we do this work, they become vocal about injustice. They lift up people that are invisible. They use their power and privilege and education for good. And so in their own way, I know my daughters, as they pursue aerospace engineering and pre-med, that they are going to continue to keep justice as a part of their work in their heart. And so thank you, Moms Clean Air Force, for being that impetus over 16 and 19 years ago. Because as moms, that's what we're called to do. We are charged with the greatest gift of all, to try and raise some good human beings to protect the health and teach them values and contribute to society. Before I even stepped foot to serve in the Biden-Harris administration in 2022, it was ingrained in my heart and mind as a young person to always use my power, what little power I might have had, for good. My mom, Terry, through her decades of work in human services in Detroit and across this country, showed me the importance of supporting families and children. In our family business and ministry, we served low-income families. We worked for folks to try and escape welfare and poverty and to get good-paying jobs. We worked with low-income and sometimes no-income pregnant moms to make sure that they were connected to resources so they could have that healthy baby. We organized environmental health fairs at my church in Detroit to make sure that children could get tested for lead and they could understand with their caregivers that were sometimes their grandparents, the impacts of the environments they were in and what that did to their health. And the trauma when we see our babies and grown folks that's associated with climate extremes and climate disasters, whether you're talking about extreme heat or flooding or hurricanes, or just losing energy, that can take a mental and physical toll on our children. So I know, and I have lived firsthand, the impacts of this work that we have all been talking about today and the importance of maternal and child health. But we also know that good, strong, justice-focused policy can play a role in reversing the reality that we see. Having the privilege of serving in the Biden-Harris administration as the first federal chief EJ, environmental justice officer, and leading this first office, which I hope won't be the last, Office of Environmental Justice in the White House, to help create this institutional and cultural change across the federal government to make sure that our policies and practices actually were intentional in supporting low-income folks and Black and brown folks and Indigenous folks to be able to live in a healthy and sustainable environment. That was an opportunity of a lifetime and an honor. And I got to witness even more the power of good policymaking. And we hit some major milestones related to meeting our children's needs, maternal health needs, clean air, and environmental justice. And so as we think about, because it's important to reflect and not forget, I want to talk about just a couple of those milestones. So again, under President Biden and Vice President Harris, we provided a historic expansion of the child tax credit, leading to the lowest child poverty rate, because poverty is connected to injustice in American history in 2021. We created the first ever summer nutrition benefit, helping the families of 30 million children nationwide who rely on free and reduced price lunches. In terms of women's health, the president and the first lady launched the first ever White House initiative on women's health research, which we heard it is still needed. When we think about climate and clean air, President Biden secured more than $50 billion with a B dollars for climate resilience and adaptation through the Bipartisan Infrastructure Law bill, or the Inflation Reduction Act, the IRA. We created a national climate resilience framework to advance locally tailored, community-driven strategies. And the president fought to bring solar and clean energy into disadvantaged communities across this country. And the administration took on, again, actions to tackle plastic pollution, which again we heard about, releasing the first comprehensive government-wide strategy to reduce plastic pollution and its impacts. And when we reflect on the environmental justice work, again, we took broad regulatory action to protect the health and secure environmental justice in communities across this country that have been dealing with legacy pollution, bad air, bad water for so long. And through the Justice 40 initiative, President Biden set a goal to deliver 40%, but we end up delivering 71% of benefits to climate and clean energy and sustainable housing and clean water. These investments going to communities that have been historically overburdened by pollution and underinvested in and simply forgotten. Now, that's only a snapshot of some of the accomplishments of the past administration that I believe laid a strong foundation and was a direct response to the advocacy of organizations like Moms Clean Air Force and social and environmental justice organizations across this country. But we know things have shifted a little bit since January 20 of 2025. Everything that we valued, the protection of our environment, public health, equity, environmental justice, our humanity, was starting to be destroyed, dismantled, and disrespected. Like denying the funds that we promised communities, getting rid of executive orders on environmental justice, rolling back environmental rules and regulations to reduce the exposure to hazards, slashing our federal agencies and changing the everyday lives of thousands of federal workers. These 100 days or so have been traumatic, they have been frustrating, and they have been scary. But if I have any moms in the room, you know we don't stop when things get hard. We work harder, we work smarter, and we do whatever it takes to protect our babies. At least I feel that way. Do you? Yes. Okay. And that is the mindset that we have to have. So as we sit and breathe this reality we are all facing, whether we like it or not, the questions become, how do we even think about moving policy in the midst of mayhem? How do we keep this movement for maternal and child health strong? And how do we maximize our mommy skills in this madness? Well, I'm glad you asked. And I'm here to remind you that despite our reality, you are a force. Force is in your name for a reason. Because in 2025, we got to think about force in a different way. So for me, the F in force stands for facing your fears. The O, organizing the chaos to drive innovation. The R stands for realizing your power. The C stands for constantly crying out loud. And the E stands for exerting aggressiveness at all levels. So let's dig a little bit deeper into what that force means in this moment. So let's start with face your fears. Now, working at the White House and in the federal government was new to me. I had never worked in a previous administration. I had never been in the federal government. I didn't know how to play politics. That was not me. And my background and experience was a little bit different than my colleagues. And so even though deep down inside, I knew that my experience within the movement, having led a policy office for an environmental justice organization as a scientist and researcher, could be helpful. But one of my fears was not being seen or heard in this institution where people had worked for multiple administrations or they had worked on Capitol Hill, and folks would be a little bit scared about doing things differently. But a little voice inside of me said, this is not the time to get scared and lose that disruptor mindset that I've had, regardless of whatever role that I've been in. And even though being in the White House was a little bit intimidating, I couldn't waste this opportunity to let fear quench my passion for protecting people and advancing justice. So I can imagine maybe some of you in this room and in the virtual room might be a little bit intimidated and tackling some scary situations as a result of the actions of this current administration. I know I am. And that's to be expected. But what we can't afford to do is let fear freeze us or cause us to retreat quietly. So continue to advocate on Capitol Hill, continue to advocate in your communities, continue to push back against policy and practices that go against our morals and what we stand for. Because if we don't face our fears, our communities and our children will lose even more. So moms, you must be a force by facing your fears, because your experience, your wisdom, and your grit is what is needed in this moment more than ever. So let's move on to the O, organizing the chaos to drive innovation. Now, the Newsom household is always a little chaotic. We are either juggling multiple school events, going to this track meet, this game, doing dishes, tending to our multiple dogs and cats, driving to this, whatever. It can be chaotic. But one situation where I think the chaos of my life has actually been value added is in making a great dinner. And making that dinner in about 15 minutes from what's left over in the refrigerator, what's in the pantry, and I used to call it for my daughters, chicken surprise. And they would praise me for it, and they still do it to this day. And so whether we have chaos in our life, chaos in the movement, it can drive innovation. So my challenge to you in each of this room is to use the confusion and the craziness of this moment to drive that innovation in policy and practice and partnership. So for example, how can we use the chaos of the regulatory rollbacks in environmental policy to create the policy prescriptions we want to see in 2029? How can we use the chaos of the dismantling of the Environmental Protection Agency and other federal agencies to develop new systems of measuring, tracking, and enforcing air, water, and waste regulations at the state and local level? How can we use the chaos surrounding the disregard for diversity, equity, and inclusion and justice to reimagine how the values and concepts of environmental justice principles can be creatively and stealthily integrated into local climate resilience plans? Or better yet, how do we use the chaos to begin to set a new table to rebuild trust in those offenders in your community, those environmental offenders in your community, so you can talk about how we can actually make this community safe and healthy and what we all deserve? Now, those ideals might seem far-stretched, I know, but I truly believe that in this chaotic time, that's the way we have to think. We have this opportunity to reimagine what we want, to reimagine the systems that have failed to protect us, but also force us in a way to innovate for the future. Now the R, in realizing your power. One of the most amazing parts of my life was the privilege I had to take care of my grandparents in their late 80s and 90s. I witnessed firsthand the risk of extreme heat on them and other elders in my community where I grew up in Detroit. And over time, through my research, I realized that this was not a Detroit thing. It was folks across this country suffering from the impacts of extreme heat, primarily our Black and brown, our low income, our houseless and homeless, and our seniors. And so my work and research at this intersection of climate change and environmental justice and public health with this focus on extreme heat started because I was unsatisfied with the level of knowledge, with the lack of resources, with the lack of policy, and the lack of attention being paid to the impacts of climate change on elders and houseless people. I was mad, but I was just a granddaughter. But I tried to use my little bit of power to push policy at the city level. So I urged the creation of an extreme heat task force in Detroit, and I got it. I made sure that Meals on Wheels did health checks when they dropped off the food to make sure that the indoor temperatures in the seniors' homes was a healthy level. I realized my power and how I could use it as a force for not only protecting my grandparents, but other seniors and elders that sometimes had no voice. And I would imagine that sometimes we might feel powerless too, particularly when we're trying to forge a new path to create climate policy or other policy that is strong and grounded in justice principles. Well, moms, if no one else tells you today, I'm here to tell you, you are powerful because we stand on the shoulders of our ancestors that include some powerful women. When I feel powerless, I think about the women in the suffrage movement who were fighting for simply the right to vote, and members of my sorority who pushed for social action in the early 1900s. When I think about feeling powerless, I think about, again, the many testimonies, hundreds of testimonies I heard from mothers and grandmothers during our White House Environmental Justice Advisory Council meetings that not only brought me to tears, but exemplified the fortitude of women fighting for their families, despite the loss of life and despite sickness. And when I feel powerless, sometimes I think about the 4 decades of folks across this country that have kept the environmental justice movement strong. That foundation we come from does not allow us to feel powerless. And we also have a foundation that was laid by the Biden-Harris administration. We are not starting from scratch. We have model policies, we have frameworks and tools and recommendations that we can use from the last administration that can be translated to the state and local level. So I encourage you to remember the foundation of our ancestors and the opportunity to build on the strong foundation from the last administration to advance maternal and child health and environmental justice in your communities. You are a force because you are powerful. And to be a force, we must, again, using the letter C, constantly cry out loud. Now, when our babies and children want our attention, they have this amazing political strategy of crying or repeating the request over and over again. And these actions typically garner a response, whether they get what they want or not, they get our attention and a reaction. In many situations where I've been advocating for certain policy, wherever, it requires a consistent, repeated articulation of the demands and desires of communities that I was called to serve, that we are all called to serve. So what we are asking for challenges the power structures. It makes people uncomfortable. It disrupts the normal that really isn't normal. And that's exactly our role, to keep crying out loud until we change the culture, to make the vision visible and nurture the seeds that we have planted until we see them grow. And last but not least, if y'all are still with me, to continue to be a force, we must exert aggressiveness at all levels. As we fight for our environment and our health, we need an approach to a challenge across multiple levels now more than ever. This work, the broader movement for environmental protection and environmental justice, I just want to remind you, it didn't start in the federal government and it won't end in the federal government. The people make the movement. And so one of the strategies that I think has always been pretty effective over the past 20 plus years of my advocacy is applying pressure from all sides and at all levels, inside, outside, local, state, federal, regardless of who's in power, and in private industry as well, to get us closer to our goal. So in this moment, I feel that there are 3 ways that we must exert our aggressiveness when it comes to protecting maternal and children's health. The first, we have to be aggressive in demanding accountability. States and localities, as it's been said before, have the opportunity and the autonomy to reduce, maintain, or strengthen permit regulations and requirements on air and water and other environmental hazards. Environmental protection happens at the local level. So it's time to strengthen our focus and make sure that we are concentrated on those state and local laws and zoning ordinances and things of that nature. The second thing is that we need to be aggressive in expanding our networks. I used to tell my daughters, make new friends. Because based on the trajectory of this current administration, there will probably be less attention and less resources coming from the federal government to address climate and the things that we care about. So we have to be aggressive with creating those new partnerships and friendships that will be able to fill some of those gaps created by this current administration. So this is an opportunity for philanthropy and private industry to step up and step in, because we know the impacts of climate change are not going to disappear and go away. And we need to make sure that we have those infrastructures that are going to be able to come in and help with response and recovery in lieu of our federal agencies not being able to play the role that they have played in the past. And last but not least, we got to exert aggressiveness in getting into leadership. Now, it might be difficult to get policy passed now at the federal level and over the next couple of years, but that doesn't mean all is lost. There are many cities and towns that will be holding elections this year. It is an opportunity for y'all in the room and in the virtual room to take your advocacy and work to the next level. By running for office, working to create local and state policy that actually embodies what we're fighting for. So moms, again, if you remember anything from what I've shared today, is that you continue to be a force to be reckoned with. And use these next couple of years to not only play defense, but be proactive in building the future that we want to see. So again, we must continue to face our fears. We must make sure that we organize the chaos to drive innovation. We must realize our power. We must continue to cry out loud. And we must exert aggressiveness at all levels. So let's continue to be a force and center people and health and environmental justice in all of our policy solutions and activate the work at the local and state level like never before. Thank you so much for the opportunity to be here with you today. And remember, if we don't fight for our kids, who will? Thank you. Oh, just go.
Please welcome the Director of Strategic Implementation and Justice for Moms Clean Air Force, Stephanie Reese.
Wow, thank you. What a good morning. And I can tell you, after all this knowledge that I've just taken in, I am feeling called myself. I am Stephanie Reese. I am the Director of Strategic Implementation and Justice with Moms Clean Air Force. And moving through today's conversations, as I think about my own motherhood, my own experience in motherhood and my two sons, I'm reminded of the urgency of this work and the need for us to continue to come together and uplift this critical issue facing women of color. We've heard difficult truths this morning, stories of injustice, data that underscores disparity, and powerful stories that remind us all of what must change. But in the face of all this, when the road seems too hard to travel, as communities of color have practiced for centuries, we create space to come together. We come together to reflect and to heal as a community. We make space to acknowledge the emotional weight that we carry both individually and collectively. That's why I am looking forward to our next speaker. She brings a long-standing commitment to justice, a powerful voice to help us center ourselves in purpose and a deep understanding of community healing. Please join me in welcoming Reverend Leslie Copeland-Toon.
Good morning. In my tradition, we say, this is the day the Lord has made. Let us rejoice and be glad in it. I am so glad to be here with you today. I've been listening, and let's take a breath. Let's just Yeah, there has been so much shared, and my goodness, I am inspired and motivated and negotiating, maybe like you, some righteous indignation, right? That the fact that some of the statistics that we heard were things that W.E.B. Du Bois was talking about a century ago, and we're still having to address these issues is really astounding. I am a mother and a minister and an advocate. I work for the National Council of Churches. I'm Senior Associate General Secretary and Advocacy Director. And I also serve as the chair of the board of the National Religious Partnership for the Environment. So these are issues that are close to my heart. I met Stephanie out in the street in front of the EPA, calling for justice for EPA, strangely enough. But some of what I've heard so far today is talking about good stewardship of the environment. I started to turn around and change my clothes once somebody was talking about the plastics in our clothes. I was like, oh, Jesus, let me. But no, I will self-correct at a later time. But that, was important to know. So stewardship of the environment is part of what we can do. Organizing and working together is part of what we can do. Being persistent and not giving up is part of what we can do. As a mom, and maybe some of you know, I'm nice and kind. I try to be friendly, love my neighbor. But if you mess with my children, I turn into a combination of Black Widow and Wonder Woman, right? And so I feel like what we're here for is because there are people messing with our children. And not just our children, but the children, our children's children and their children, our mothers, our fathers, those who have come before us and those who will come after us. And so we have to turn into a justice combination of those who kick butt and take names. I say that in a theologically deep way. Amen. So I want to be very quick, but I do want to lift up a scripture that really just arrested me as I thought about this moment and us being together. It comes from the book of Jeremiah, which is in the Old Testament. It's a verse 30:17, which reads, "For I will restore health to you, and your wounds I will heal, says the Lord, because they have called you an outcast. It is Zion, no one cares for her." And I think about what it takes to have in this moment radical hope in the midst of it all. I mean, we've heard so many things that make us feel like we have no hope and that we have no power. But I don't know about you. When I was growing up, we all used to always say information is power. And so what I feel like is that we have been empowered today by the information that we have received, empowered to do the work. But we're not doing this work alone. I'm a Christian, and I believe that while we are looking at God, and I had some questions as I was coming here and praying and listening to some of the reports, I was like, okay, Lord, now I need you to move in this situation. But God is also looking at us. That God has expectations of us to be God's hands and feet in the world. And while we come from different traditions, whatever source that you believe in, that there is a universe, and we believe even that there's a great cloud of witnesses that helps us, that compels us, that urges us to move on, to run on, to see what the end is going to be. I believe this text that from Jeremiah really is a statement of promise and a statement of faith, a statement of encouragement, and in some cases, for some of us, a statement of fact. Some of us in this room know that God is a healer. I've been healed. Some of us know that God is a restorer. Some of us know that in the midst of it all, that God hears our cries and responds to our needs. And I believe I'm a witness as well, that God especially responds to the cries and the needs of mothers and of children and of the most vulnerable in our world. I want to suggest to you that not only is this a promise of healing and restoration, these words from Jeremiah, but as we are in the midst of the unfolding of an environmental nightmare. I want to suggest that God restores and God heals are statements of radical hope that we can embrace, that we can declare that we can find fortitude and resilience to look hopelessness, environmental degradation, the turning back of progress that we have made in the environmental impacts, uncertainty. We can look economic downturn, fear and despair in the face and proclaim that God restores itself is an act of resistance. And I want to offer a radical act of hope. It is believing that we will live and not die, that we will survive and not just thrive, which someone mentioned and said earlier today, because God is with us. The challenges seem insurmountable, but God does restore. And it's up to us to make that restoration manifest in this world. The situation is so dire when Jeremiah is writing to the people that he cries out, the harvest is past, the summer is ended, and we are not saved. For the hurt of my poor people, I am hurt, I mourn, and dismay has taken hold of me. Is there no balm in Gilead? Some of you may be familiar with that text. Is there no physician there? Why then has the health of my poor people not been restored? But the answer in Jeremiah 30 is, I will restore health to you, and your wounds I will heal. And to be honest, I've had some moments of anxiety and concern, of deep lament during these past 109 days, to be exact. Yes, I'm counting. And I'm counting on us. I've wondered, and maybe you have as well, what in the world is going on? Some of this seems so commonsensical. Why would you overturn progress that has been made for our air to be clean, for our water to be without pollutants? Why would you do that? It seems that we would want these things for not just for Black and Brown communities, but for every community, because air does not stop just because they see someone who is not Black or Brown. Amen, somebody. Air, we breathe the same air, we drink the same water, and yet these policies have been reversed. But I am convinced that the answer to the questions of what is going on and what do we do and how do we win back, how do we fight evil and win back hard-fought battles to end the deadly impacts of the environmental disasters that we have seen, the air pollution, the toxic chemicals and plastics, the extreme heat, all of that. What do we do? Well, I am convinced that the answer is in this room and watching online. I'm convinced it is up to us, each and every one of us, to say enough and no more, and to back up those comments with our actions. I believe that it is up to us to, as I said, to organize, to make friends with people we might not normally be friends with, and to do it for the sake of ourselves, for our children, and for our children's children. We're in a situation we've never seen before, but there is still hope, and hope lies with us. We don't know when it will end, but we have to keep pressing and marching and speaking out and standing up with hope as our foundation and faith as the wind at our backs, fortified with our love for our children and our future, and determination with a made-up mind that we will continue to fight until victory is won. I am reminded today that joy does come, that as the spiritual says in my tradition and culture, trouble don't last always. That truly God is with us every step of the way, that strength to endure will come, that peace will come and comfort will come, that restoration will happen. Hope will not disappoint us. Grace and mercy will abound. We do not walk through this alone. We are not alone. We are in this together, and together we will make it through. And I'll leave you with the words of the Apostle Paul in the New Testament in my tradition, 2 Corinthians, that's 2 Corinthians, not 2 Corinthians, 4:7-9. And I hope it resonates with you. I almost felt like I could just read this scripture and sit down. But it just has resonated so much with me as we've seen all of the chaos these last few weeks, 109 days. But we have this treasure in clay jars, some translations say in earthen vessels, so that it may be made clear that this extraordinary power belongs to God and does not come from us. We are afflicted in every way, but not crushed. We are perplexed, but not driven to despair. We have seen persecution and feel persecuted, but we are not forsaken. We are struck down, but we are not destroyed. It is up to each and every one of us. The numbers are dire. The circumstances are overwhelming. It looks like the odds are stacked against us, but we have a secret weapon, if you will. There is nothing that can stop a woman, a mother, or any of us when we have a made-up mind. When we have radical hope in spite of the circumstances, and when we come together, solutions come, answers come, situations change, healing comes, and restoration comes. And with God on our side, we can have radical, revolutionary hope. When we come together, we are a force to be reckoned with. We can do the work and trust that restoration is coming and is on its way. Amen, and God bless you.
Awesome. Wow, thank you so much. As our event comes to a close, I want to thank you all for being with us this morning. Thank you to our speakers, our media partners, the 19th, the amazing moms team who poured their hearts into this event. We came together today to shine a light on the maternal and child health crisis facing women in communities of color. But, you know, today's forum is not the conclusion. It is the continuation of a very important discussion that needs to be had, not just among people of color, but by allies, policymakers, and anyone invested in the health of mothers and children. And as Reverend Copeland-Toon just said, hope lies with us. Thank you again for your presence, your voices, and your commitment. Have a great rest of your day.